What causes snapping hip syndrome? If you have a snapping hip, you may be wondering what causes it, how serious it is, and what you can do to get rid of it. I'm Dr. Dave Candy, and in this video, I'm going to explain the two different types of snapping hip syndrome, what causes them, and 5 different exercises that you can use to get rid of snapping hip syndrome. Now, there are 2 types of snapping hip syndrome. One is an external snapping hip syndrome, where your IT band runs over the outside of the hip. And the second one is an internal snapping hip syndrome that you feel more in the groin, where your hip flexor or iliopsoas tendon runs down through the groin. That internal snapping hip syndrome can also be caused by things within the joint, like a labral tear of the cartilage on the inside of the joint. And I've got another video that I'll refer you to for a labral tear in the hip. I've also got a separate video covering the IT band pain on your hip that causes that external snapping hip. So if you get the snapping hip on the outside of your hip, that's caused more by an IT band syndrome. And I'll refer you to that other video for more information on that IT band syndrome or the external snapping hip syndrome. But if you get internal snapping hip syndrome, snapping in the groin or in the back of your hip, that's more what I'm going to cover in this video. Now, I actually have an internal snapping hip syndrome where when I do movements like this, I can feel a snapping, and mine is actually kind of deeper inside. Can't feel it from externally. It's been there for years and it doesn't hurt. And snapping hip syndrome actually occurs in about 5 to 10% of the population, and most people like myself don't have any pain from it at all. So if you do have a snapping hip, it's probably not anything serious to worry about, and that's whether you have an external or an internal snapping hip. It's probably not a big deal unless it starts to give you trouble. Now, I have found some things that I can do to control my own snapping hip just through self-discovery, and I'm going to share a couple of those with you. Now, just to give you an idea, I'm going to take a microphone and put it a little closer and see if you can actually hear the snapping hip. So I'll explain to you a couple of the different exercises that I've found to be helpful for snapping hip syndrome. Now, because when you lack external rotation range of motion, it causes more of that hip popping. One of the things you can do is try to improve external and internal rotation of your hip. Now, external rotation is where your hip rotates externally, which can be confusing to some people because it actually makes your foot go inwards. So as your foot rotates or your hip rotates externally, your foot goes inwards. And as your hip rotates internally, your foot goes outwards. Now, if you look at the difference of range of motion, you'll notice that this leg on me goes in a lot more than that one. This is also a lot harder for me to do. This feels like this is really working. That's pretty easy to do. External rotation, coming up this way. So again, the leg goes inwards, but this is external rotation. This way, that's about what I got here. So you can see the difference in range of motion, as well as this is much more difficult to do. So just practicing those motions, the internal rotation in seated, where you're just trying to move the leg and the foot in an outward direction, that improves internal rotation of your hip, and external rotation, trying to drag your heel up your shin like that. Now this actually, as you drag it further, it's hip flexion and external rotation, which uses that hip flexor or iliopsoas muscle as you start getting up higher. Going up like that and then coming into an outward position. So that's the first exercise to help a snapping hip syndrome. So the second exercise has more to do with your abdominal stability. And your hip flexors, they actually attach to your lower back or your lumbar spine. So they attach to the front of your lower back vertebrae. And you need to be able to use your abdominal muscles to stabilize your vertebrae in order to stop your hip from snapping. So one common test for snapping hip syndrome that doctors will use is just to have you go back and forth like this. And if you get a popping in your hip, there it was, clunk, 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 then that's a test for snapping hip syndrome. Now you can stop that from happening by stabilizing your abdominal muscles. And if you're doing like a bicycle type exercise, there's the clunk, clunk. That's a common time when people will also get snapping hip syndrome. If you tighten your abdominal muscles, put your lower back down flat into the table or the bed or the ground or whatever you're laying on, and then lower down, keep your back flat, and then come back. No popping, no snapping there. Let the abdominals go, and it's back. So strengthening your abdominal muscles, trying to tighten down, and only going as far as you can without getting that popping, and then coming back up, going down, coming back up, going down, coming back up. That's the second exercise to help with a snapping hip syndrome. Now, third is strengthening your gluteus medius muscle, or the muscles that abduct and externally rotate your hip. So as you're doing like a hurdle, you're going in an abduction position, which is out to the side, and also externally rotated position. So that is what your hip flexor does, and your gluteus medius is the abductor, external rotator of your hip as well. So to strengthen that, one common exercise that people do is clamshells. And I've got another video covering this in a little bit more detail. But what people will typically do with clamshells is they'll just roll their back backwards. And that's not really any good because then you're just using your back rotators. You're not using your gluteal muscles. So to do a clamshell correctly, you want to roll forward a little bit and just squeeze the bottom muscles. Now notice there's not a lot of movement when you do it like this. You're just tightening your bottom muscles here, not allowing yourself to roll back like this, staying rolled forward and squeezing your glutes there. So that's the third exercise. The fourth exercise is a variation of a hip external rotation exercise where you lay with one leg in front, one knee bent like this, and then you just lift the heel. And I'll show this from the opposite angle as well so you can see it from the back. But the hip is straight and you're rotating the heel. So you're keeping the knee on the table or on the floor and just lifting your heel up. Again, this is an external rotation strengthening exercise. Now you can do that in another position too, where you bring your hip up to 90 degrees and then you try lifting. Now this is very similar to the dragging the heel up your shin exercise that I showed earlier, but gravity's pressing down against you this way. So this is a little bit harder. You have a greater gravity component fighting against you when you're doing the sideline. So this is a little bit harder and a little bit more isolated than dragging your heel up your shin. Now to show you that from the opposite direction so you can see it from the back side, I'll show it this way. So this is with the leg at in a neutral position and just lifting the heel like that. This is with the leg at a 90-degree angle where you're lifting the heel like that. So that's the fourth exercise. The fifth exercise is going to be an internal rotation strengthening. So you can do this again with your legs straight, with a pillow between your knees like that, or at 90 degrees where you're lifting up this way. And again, this is fairly similar to the seated exercise that I showed earlier, but again, there's that gravitational difference that the gravity component is pressing down that way a lot more than when you're sitting up. So this has a little bit more resistance than when you're doing it in a seated position. So those are the 5 exercises to stop a snapping hip syndrome. Now, functionally, when you are trying to do that hurdle position or the abduction external rotation position that you may do in dancing, if you kind of integrate all of those things, if you tighten your abdominal muscles, bring the hip out to the side, and then bring it through like that. Now this actually incorporates balance into it as well, and if you are an athlete like a hurdler or a dancer, you need to be able to balance while doing these things. So this is more of a functional movement pattern. Now actually, after having done just those few little exercises, I'm getting a lot less snapping now. Every like 4th or 5th one, it will still snap, but a lot less snapping than at the beginning of this video. So hopefully if you have a snapping hip syndrome, you find some of these tips helpful. Again, these probably won't work for every type of snapping hip, but if you have an internal snapping hip, this may help you out. And if it did, leave a comment below letting me know how it worked out for you. Now, if you're watching this from the St. Louis area and you need some more help for a snapping hip, we'd be happy to help you out at More for Life. Just contact us through our website or give us a call and we'll get you scheduled in for an appointment. And no matter where you're watching this from, if you found this video helpful, give it a like and subscribe to our channel so you can get notified of our future videos. Thanks for watching and have a great day.